I'm Lois. I'm the founder of Restored Eden Physiotherapy, and today we're going to do session 1 of Pilates for pregnancy. So let's get started. So I'm going to do some exercises, but I'm going to talk you through what pregnancy and doing exercise is all about. So let's just start by rolling our necks. So we're just stretching our necks and making sure that we've got a full mobility. So if you're doing exercise and you're pregnant, obviously you've got a big belly and it's quite difficult and uncomfortable to be doing anything on your belly, for example. That's not going to work. That's if you're really far along your pregnancy journey. So these exercises today are for anybody that is up to 40 weeks pregnant or 41, whatever, basically until you give birth. If you've only just got pregnant, then I would say you can do any exercise because the baby is so small, it's not causing you any restriction, and it's more restriction when it comes to Pilates rather than because it's bad for you. The only restriction with pregnancy is you shouldn't get your heart rate above 140 beats per minute. And basically what that means is that you shouldn't be like absolutely going for it, like doing an Olympic race. But you should be doing exercise. It's okay to get out of breath, but it's not okay to go to maximum heart rate. And then also when you get to about 7 months pregnant, your hormones start to kick in and your ligaments start to get very lax around your pelvic area, and then you need to be careful of overstretching your pubis symphysis, which is the ligament which holds your pelvis together in the middle. So there's like two parts of the pelvis which in men are fused together, but in women they have to separate in order for the baby to come out. I actually made this mistake myself, and I was a PE teacher in an international school, and I decided to absolutely run at my fastest for a whole hour playing catch with all of my classmates. Not classmates, I was the teacher, but I was teaching year 4 and I ran really fast the whole hour across this football pitch in every single direction, and then an hour later when it came to walking home I just couldn't walk because I'd overstretched my pubis symphysis ligament and it got inflamed, and then I really did have a problem for about 18 months after I'd had my baby. It caused a lot of problems, but anyway, it's all resolved now, so just don't do that. That's one bit of advice I can give you. And so doing exercise when you're pregnant is really important because you should be doing exercise. Everyone should be doing exercise, and just because you're pregnant, that doesn't mean that you don't need to do exercise at all. But you just need to choose what kind of exercise you do, and that's what we're doing here. We're doing exercise, but not letting the fact that we're pregnant limit it. I'm not pregnant, by the way, but I do have 4 children, and so I have been pregnant 4 times, and I know what it's like to have a baby and do exercise whilst having 3 children to look after at the same time. There's no real restriction in terms of carrying the baby, although carrying a lot of heavy stuff is probably not advisable because your body is under stress by itself by being pregnant, and then if you start trying to do too much, then that can overstress your body, so don't do that either. But if you feel like whatever it is that you're doing is easy and straightforward, then it's okay. I think listening to your body is the most important thing. just going to tuck my t-shirt in. So we're doing pelvic tilting, and we're purposely left having a room underneath us where the belly can just do whatever it wants. There's no restriction and there's nothing getting in the way. And we're trying to get mobility and strength going, because if you don't work your muscles, then the muscles get weak. And then if the muscles get weak, then they're going to be weak after you give birth, and in which case you're going to have to work a lot harder to get your strength and mobility back. So what we're doing is we're just trying to maintain the exercise that maintain the fitness, strength and range of movement of our joints whilst we're pregnant. So being pregnant doesn't mean that you shouldn't do any exercise at all. Throughout all generations, people have had jobs to do. So if you were a farmer, you would continue to do all of your farming jobs. If you have like 20 children, you'd continue to have to look after your 20 children while you're pregnant. So I don't really believe in doing nothing when you're pregnant, but I do believe in, if there's some like really heavy thing, then you should get someone else to carry it so that you don't have to when you're pregnant. I personally went swimming every day when I was pregnant, and that was really helpful, not just to maintain my fitness and flexibility and strength, but also it was really helpful because I was able to cool down and I was able to move in ways that I couldn't move, because I just really felt really fat when I was pregnant and a bit of a frump. Like, I don't like the feeling of being fat at all. And then I didn't really look pregnant at all when I was pregnant. I didn't look very pregnant. I didn't have a very big bump. I didn't have any swelling. I didn't have any problems or complications at all. So as far as pregnancy goes, I did it okay, but I just felt like I was fat all the time. And then all I could think about was, as soon as I've given birth to this baby, I'm going to be going on a diet. That's all I could think about because I just felt like such a frump. But now, just so you know, I would have been going all the way down like that, but I'm bearing in mind that I'm pregnant. So rather than going all the way down into child's pose, I'm going to take my arms out so I've got room underneath my belly and just stretch like that, so that I have got no restriction across my stomach. And then I'm going to stretch forward. So I normally would put my legs on the floor and do a back extension, but I'm not going to do that because I'm pretending I'm pregnant. So I'm taking my arms forward and stretching my stomach, but I'm keeping my hips in the air. But because my hands are so far forward, I'm still getting a back extension. So I don't know if you can see that, but there is no reason why you can't stretch your stomach. So you're stretching your skin, you're stretching your abdominal muscles, and basically you're using your abdominal muscles, but you're not restricting the baby, and that's okay. As I was saying, I went swimming a lot, and that helped me to stretch in every direction. And because I could stretch in every direction, then I maintained the flexibility of my skin. I maintained my strength. I got to move. I got to decrease the temperature of my body by going swimming. So I think that's probably why my legs didn't swell up, because I was getting a lot of mobility. When I swim, I've got good technique because I used to be a swimmer. When I was younger, I used to do competitive swimming, and swimming when I was pregnant and swimming when I'm not pregnant is exactly the same because there's no restrictions. I used to do butterfly when I was pregnant, and especially butterfly kick on my back with my arms above my head. That really works your abdominal muscles, but you're not squashing the baby, so therefore it doesn't hurt. Let's change direction. So it's really very effective at maintaining the strength of the abdominal muscles, which is very handy because you don't want to lose the abdominal muscle strength, because obviously the baby is making everything stretch out, and so you want to maintain the strength but also just go with the whole fact that everything is stretching. So now just going to go forwards and then go back. So we're leading with our heel, going backwards, and leading with our toes going forwards. So heel going back and toes going forwards. So this is helping our glutes to work, and I'm also drawing my pelvic floor up and drawing my belly button in. Okay, and then I'm going to swap sides. So circles. So yeah, I think that when you're pregnant, you don't particularly have to eat anymore. I think that naturally you will feel like you're really craving something, and if that thing that you're craving is healthy, then go for it, eat it. Like, for example, when I was pregnant, I was very conscious of what I was eating, and I never ate anything apart from healthy food. Like, I would eat vegetables, meat and carbohydrates, but I never ate any chocolate or sweets or cake, because I was thinking, oh, if I eat that unhealthy thing, then I'm feeding my baby chocolate biscuits, which I don't want to feed my baby chocolate biscuits, so therefore I'm not going to eat any chocolate biscuits, because I don't want to feed a baby chocolate biscuits. I wouldn't give the baby chocolate, so I'm not going to give myself chocolate. And in terms of what I mean by cravings is, when I was a teenager, I would eat a lot of cheese because I was growing, and my body obviously just needed cheese in order to get enough calcium in my body. But I didn't need cheese like in my 20s until I got pregnant. And then when I got pregnant, I suddenly was like, oh, I really just want to eat some pizza. And I think that's good. Like, pizza, it's not particularly healthy, but it's not particularly unhealthy. I mean, it's all right. I mean, basically, if you're hungry, then it's good. Okay, so now we're going to lie on our back. It's not always very comfortable lying on our back, but we're doing something, so I think it's okay. So we're lying on our back, and we're going to pelvic tilt. So we're lifting up and then squashing our spine on the floor, and then lifting up and then squashing on the floor. So we're not going to be in this position for very long, because I personally didn't used to like lying on my back when I was pregnant. I felt like I've got a huge basketball squashing me down. But we're just going to do this for a few minutes. So we're going to roll up, and then we're going to go into a bridge, and then we're going to roll down again, and then we're going to roll up. So we're drawing our pelvic floor up and in, drawing our belly button in. It's okay to draw your belly button in when you're pregnant, and it's a very good idea to try to have a flat stomach when you're pregnant as often as you can. So what I mean by that is, you could just let everything hang out, or you can, when you're standing there and somebody's looking at you, you can try to look like you're not pregnant by like squeezing everything in. And obviously you're going to look like you're pregnant if you're quite a few months down the line, but that process of drawing everything in and not just like letting everything hang out is working your abdominal muscles, it's working your pelvic floor, and that's really good practice, because when you've given birth, you need to get your pelvic floor working as quickly as possible, because if you don't, then that's when you can have problems with going to the toilet when you don't want to go to the toilet, like weeing in your knickers or something, because everything when you give birth stretches, and so then you need to try and suck that back in again and get that control. So just another tip, when you've given birth, then it's a really good idea to start skipping with a skipping rope. And when you initially, if you've just given birth to a baby, especially like with me, like when I'd had 4 children, I was fine until I started skipping, and then I'm being honest now, like I did used to like wet myself if I was skipping, like only slightly, but I'm just saying that like I'd had 4 children, and like that control was not like 100% when I was skipping up and down, up and down, up and down. But then I practiced it and practiced and practiced, and then I was able to gain that control, and then I was fine. So like, you know, after a few days where my body's like, okay, right, I need to get some pelvic control when I'm jumping up and down, like your body does what it needs to do. So if you force it to cooperate with you, then it will cooperate. And basically the people that struggle are people that aren't actually actively doing something about a situation. So basically, like, you need to spend the entire time thinking about your pelvic floor and thinking you need to draw everything in and up and tight, and your stomach in, up and tight. And when you're aware of these things all day, then it makes a really big difference. Now we're going to do some tricep dips. So we're going to bend our elbows and then come up. So we're trying to keep a straight line between our ankles and our shoulders. There's no reason why being pregnant makes any difference to this, because the baby's just sitting there having a little ride. This work is for our triceps, and we're thinking about the straight line that's between our shoulders and our ankles. So being pregnant is not preventing us doing this. And then we're just going to do some balance work now. So we're going to stand on one leg, stand with the other leg in the air, and then do some single leg squats. Again, we're going to think about our pelvic floor and think about drawing our belly button in and up, and trying to make ourselves have a flat stomach. And then swap legs. There's so many exercises you can do, and this is just the first video. I'll do another video for session 2. So please do join me for that. And please let me know when you've had a baby, and I would be more than happy to come and see you, or you can come and see me, and we can have a look at how to regain the body that you had before you got pregnant. Thank you so much for listening. Please leave your comments below, or any questions that you've got or concerns, and I would be more than happy to interact with you and give you my input. Have a lovely day. Goodbye.